A+ലേക്കുള്ള വഴി ഇനി തനിയെ തുറക്കാം. Subscribe to the Enclaps channel. Ring the bell button and open success. It's that easy.
Welcome to the wonders of living world. Hormones in our body travel through the bloodstream, but only to the target cells. Today, we are going to learn about the important hormones in our body and their functions. Well, you are familiar with the process of digestion, where complex food materials are broken down into simpler substances like glucose, amino acids, fatty acids, etc. The glucose obtained from the diet need to reach the cells for energy production. But glucose simply can't pass through the cell membrane. Who helps them to reach there? Yes, it's the pancreas. Pancreas play a major role in this process. Pancreas is the gland that is connected to the duodenum, the continuation of the stomach. There are millions of islets of tissues in the pancreas called the islets of Langerhans, named after Paul Langerhans, a German pathologist. There are mainly three types of cells in the pancreas: alpha cells, beta cells, and delta cells. Alpha cells produce the hormone glucagon. Beta cells in the cell cluster produce the hormone insulin. And delta cells produce somatostatin that regulates the production or release of insulin and glucagon. Now let's see the function of these hormones. Insulin. Cell uptakes the glucose. Glucose is converted to glycogen in the liver and muscles. Glucagon. The glycogen stored in the liver is converted into glucose. Glucose is made from amino acids. The normal level of glucose in the blood is 70 to 110 mg per 100 ml or 70 to 110 mg per 100 ml of blood. Remember that the normal value of sugar in our body is 70 to 110 mg. Do you know the combined action of insulin and glucagon helps to maintain a constant level of glucose in the blood? Let's see how this picture can be completed by including the production of these hormones that help to regulate glucose levels. The normal level of glucose in the blood is 70 to 110 mg per 100 ml. If the level of the glucose is high, the production of insulin is increased by beta cells as it converts glucose to glycogen and the production of glycogen decreases. But if the level of glucose is low, the production of insulin decreases and the production of glycogen is increased by the alpha cells as it converts glycogen to glucose. Now what happens if the hormone insulin is not produced or the body is unable to use the insulin it produces? Decreased insulin production as a result of the destruction of beta cells or the inability of the cell to use the insulin produced leads to an increase in the level of glucose in the blood. Excess glucose in the blood is excreted through the urine. The increased level of glucose in the blood leads to a condition called diabetes. It is when the level of glucose before the breakfast is above 126 mg per 100 ml of blood. The main symptoms of diabetes are increased appetite, thirst, frequent urination, etc. A blood test which helps to accurately determine the glucose level at 3 months is an important diagnosis for diabetes. Let's understand the different type of diabetes and their symptoms.
We have learned that our body is made up of millions of cells, and these cells need energy to perform cellular activities. We get this energy from glucose. But too much of glucose in our body produces a condition called diabetes. There are mainly two types of diabetes, type 1 and type 2. During food digestion, carbohydrates break down into glucose, which is carried into the blood to various main symptoms include low mass is an important organ that produces a hormone, insulin, which is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas secretes insulin. Insulin binds to its receptors on target cells and induces glucose intake. In type 1 diabetic patients, beta cells of the pancreas are destroyed by the immune system by mistake, and hence very less insulin is produced. Very few insulin binds to target cells. Thus, less glucose is intaken and more glucose remains in the blood. Patients with type 1 diabetes have to take insulin injections. Thus, type 1 diabetes are insulin dependent. They are onset by the age of 10. In type 2 diabetes, pancreas produce enough insulin, but something goes wrong with the receptor binding. Thus, the cells are irresponsive to insulin and therefore cannot import glucose, and thus glucose remains in the blood. Type 2 diabetes are insulin resistant. They are onset by the age of 40. Major causes include lifestyle, lack of exercise, unhealthy diet, etc. A family history of diabetes also increases the risk of diabetes. Major symptoms include frequent urination, thirst, more intake of water, weakness, drowsiness, and blurred vision. More glucose in blood can cause damage to various cells, thus affecting the major organs of our body.
See if you can explain these indicators now. Causes of high blood glucose level. One reason is the decrease in the production of hormone insulin due to the destruction of beta cells. Another reason is that the cells are unable to utilize the glucose produced. Diabetic symptoms and diagnosis. The main symptoms of diabetes are increased appetite, thirst, and the feeling of frequent urination. Diagnosis can be made by a blood test that helps to determine the exact level of glucose during the interval of 3 months. It's time for the question. Here goes the question. Fill in the blanks. Alpha cells, glucagon. Beta cells, can you guess? Yes, insulin. See you soon with more interesting knowledge.
3 ലക്ഷത്തിലേറെ വരുന്ന ചോദ്യോത്തരങ്ങൾ ഏറ്റവും കുറഞ്ഞ ചിലവിൽ സ്വന്തമാക്കുവാൻ ഉടൻ തന്നെ ഡൗൺലോഡ് ചെയ്യൂ എൻക്ലാപ്സ് ദ ലേണിംഗ് ആപ്പ്.